With Ttool, you can obviously do scraping style IASTM, and another popular technique that people use, and probably you use or may use, is scraping with motion. Now there's really not a lot different in the way that you'll use Ttool with scraping with motion, but for the sake of completeness, I will demonstrate a few ways so you get an idea of how you could then apply this to different areas of the body using the techniques that you know. So, for example, if we wanted to work on some of the cervical erectors or the thoracic erectors, I'll probably, in that case, given the size and the shape of the body area that I'm working here, use the narrow bevel. And so what we will do is start like this, and then I'll go here and we'll go down. And you could do single strokes like this, or while there's motion, you could do it this way too, while the head lowers. So this is one way that you could hold it, or you do this technique, or you could hold it this way. This is also a very comfortable way of holding Ttool when using the narrow bevel. And so we'll go again with the head going down, and you could either scrape sort of with like single strokes during the motion. Again, this really has to do with your personal preference of how you perform techniques. We'll go down, or we could go and work along the course of the muscle or muscles. Another treatment surface that works well for this is the rim. And so I'll hold the Ttool by the rectangular side while I use the rim, and then I'll just do the same thing. And you'll naturally find as you use Ttool that you have certain treatment surfaces that just work better for you in certain body areas. So again, you can apply this to different areas, different surfaces, depending on what your client needs and what your preferences are treating. Another one that we could do, and we'll use the wide bevel in this example, is for the upper traps and into the levator. So what we could do is starting here like this, and then I'll be holding it this way. And what I'm going to do is do these sort of long strokes like this on the upper trap while your patient or your client moves their head and their neck. And again, you could do it pulling in the opposite direction, or what you could do is push with. Again, this comes down to your technique, your style, your personal preference. And of course, you could then flip it and go and use the rim and do the same thing. You could press with the dome and do the same thing. So really, when you're doing scraping or scraping with motion, it comes down to the body area, what you feel comfortable with, the techniques that you want to use, and sort of like what you're navigating around, right? Because if you're navigating around the spinous processes, for example, you don't want to be using the wide, because then you'll start banging on the bone, and that's going to be uncomfortable. So you choose the narrow and then find the grip, either this pinching grip or the one like this, that we talked about in the scraping section, or the rim. And the nice thing is you can change between them so quickly that treating becomes much more efficient. So those are some of the ways that you could perform scraping style IASTM with motion with some of the different parts of Ttool.